Okay, for the exam, okay, NCLEX are an exam. We need to, that means there is no need to go and study all the topics. Okay, just we need to focus on the some important points or for some important conditions that is better for the passing the exam. Okay, so we know that in an NCLEX or an examination, the questions are real life scenario based questions. Okay, actually
Hmm.
I am going for the duty here in USA hospital. No, here the
Okay.
what the patients. Everything is on the system, okay, and the
Okay.
patient condition, patient vital signs, patient's investigation, everything is as like they are asking for the
Hmm.
NCLEX questions, same like coding. So that means we need to focus on, while reading the scenario itself, we need to identify which system is affected. So how we can identify each system? If it is a respiratory system, okay, if it is a respiratory system, we can focus for the saturation level. Okay, saturation means we need to check the SpO2 level. 95 to
SPO2.
100 is the normal
And
saturation. And also we need to look for the ABG. ABG means pH, partial pressure of the carbon dioxide and the
hmm.
bicarbonate. Okay, so
Okay.
if the pH is less than 7.35, that is acidosis. If the pH is
Acidosis.
greater than 7.45, that is
Alkalosis.
alkalosis. Okay, and pH and bicarbonate both are moving in the same direction. Only the
Yes.
opposite is the partial pressure of the carbon dioxide. That is the wrong method for the ABG. Okay, wrong
Yes.
method. That means respiratory opposite, metabolic equal. And also we can look for in the patient whether the patient is using accessory muscles for the respiration, or the patient is having labored breathing, or the patient is having cyanosis, and if the
Hmm.
client is having tachycardia, and that capillary refill is less than 3 seconds is the, and that means always the capillary refill normal duration is less than 3 seconds, and if it is delaying, that indicating that inadequate perfusion. These are the means diagnostic tools we can assess for a respiratory conditions. Mostly they will ask questions from areas like that the COPD patient, pulmonary embolism, chest tube, ARDS, oxygen devices, same like. And in cardiology system, we know that perfusion signs, same like only saturation, cyanosis, tachycardia, BP, hypotension, okay. And also we need to know the heart failure symptom. That means decreased cardiac output is the significant for the heart failure, because the heart is not able to pump adequate blood. So there may be decreased cardiac output, which can lead to hypertension and tachycardia. Same like shock. Shock also decreased, because in a cardiology condition mostly the NT is decreased cardiac output. So what happened? Decreased cardiac output main symptoms are the hypertension and the tachycardia. Okay, hypertension and tachycardia are the,
Yes.
yeah. So you need to check the vital signs, and if you're while checking the vital signs, if you are getting a low BP, that indicating that the client is going into a severe worsening stage. Okay, and also we can look for the cardiac medications. ECG, arrhythmia. Okay, neurologically we will get the questions from stroke, increased ICP, seizure, Glasgow Coma Scale, and meningitis. I will tell you the detail in nutshell. I will tell you in the coming. Endocrine,
Hmm.
usually they will ask questions from the DKA, that means diabetic ketoacidosis, HHS, that means hyperosmotic hyper hyperglycemic hyperosmolar syndrome. Okay, next is thyroid storm. Thyroid storm means hyperthyroidism. Okay, myxedema means hypothyroidism, and insulin and electrolytes. In renal system, we will get questions from acute kidney injury, chronic kidney disease, creatinine, blood urea nitrogen. We know when there is acute kidney injury, the creatinine level will get higher, because in acute kidney injury and chronic kidney injury, there is a decreased urine output. So the
Hmm.
creatinine or the potassium will not eliminated out through the urine because of the decreased urine output. So what happened? This creatinine level will get accumulated in the blood. Same like potassium will get accumulated in the blood, which can lead to hyperkalemia. So how we can treat it? We can do the dialysis, peritoneal or hemodialysis. Okay. And in pharmacology, mainly the drug toxicity, the peak action, for example, insulin peak action, drug interaction, and the high alert medications. And also blood transfusion, the blood should be verified or cross-checked by two registered nurses. Then infection control, mainly the type of isolation, the PPE, sepsis, neutropenic precautions, and Clostridia difficile. In Clostridia difficile and MRSA, we need to provide the contact precautions. Okay, contact precautions as well as soap and water hand washing. Okay, that means this Clostridium difficile, the pores will not killed by the sanitizer. So even we have worn gloves for giving care to a patient with the Clostridium difficile and MRSA. We need to, after removal of the gloves, we need to wash our hands with the soap and water. That is
Soap
also,
and water.
yeah, soap and water. That is also an important point. And in delegation and in priority, we know just one question we have done, which patient we need to see first, or which duty can be delegated to the UAP, to the LPN, or which duties are related to the registered nurses, like that. Okay, and because this is very important, you will get at least two questions from this delegation. Okay, and the clinical judgment measurement model is the tool which are using for the analysis of the case scenario questions. That means new gen question. Okay, mostly case study, board type, metrics, trend type, close, and SAT type questions. But what is the clinical judgment measurement model? We need to recognize the problem, analyze the problem, then we can prioritize the problem, we can plan the care, we can implement the care according to the priority of the problem, then we can after implementation, what we can do, we can evaluate the care, finally documentation. And one more thing, acute patient we need to meet the acute patient first than the chronic patient, and the unstable patient needs care first while comparing with the stable patients. Okay, that point you have to keep in your mind. So in respiratory, I have already said we can check the saturation and we can look for the hypoxia signs. Okay, and we can check the ABG, whether it is a respiratory or metabolic, acidosis or alkalosis. Okay, and any doubt on this acidosis and alkalosis? If it
No,
is,
it's clear.
yeah, it's clear, no, because it's PCO2 is affected. That means the partial pressure of carbon dioxide is affected. That is respiratory. Okay, and if the bicarbonate is affected, that is metabolic.
Metabolic.
Metabolic, and the pH is less than 7.35, that is acidosis, and the pH
Yes.
is greater than 7.45, alkalosis. Okay, and also the compensating. Oxygen usually we can administer via nasal cannula, venturi mask, and non-rebreather mask. Okay, and also the ARDS sign. That means the main complication, how we can assess a patient who is going into a worsening stage or respiratory failure. That means in a case scenario, patient has brought to the emergency department with the dyspnea, and after some time, if this sentence is showing that the client is using accessory muscles for the respiration, and there is a saturation fall, that indicating complication, what? Respiratory failure. Okay, respiratory failure. The respiratory failure is a life-threatening complication. Okay, so that patient needs what about if the client is using use of accessory muscles for respiration, that is, it is a life-threatening complication. Okay,
Okay.
life-threatening complication. Okay, and we need to identify the pulmonary embolism. That means if the client is complaining about the sudden sharp chest pain, severe dyspnea, okay, and if the client is showing any crack, that indicating pulmonary embolism. Okay, and also we need to check the chest tube intercostal drainage. That means is there any air leakage, and if the what type of drainage, amount of drainage, if and if it is the drainage is greater than 100 ml per hour, that patient need what, that can that patient we need to meet first. Why? Because there may be leads to hypovolemic bleeding, it indicating hemorrhage, and a client can go into hypovolemic shock, that is emergency situation. Okay, if it is air leakage, that means if the continuous bubbling can be noted in the drainage bottle, that indicating what, there is a air leakage, and there is an intermittent bubbling in the water cell chamber, that is normal. Okay, and the tidalling
Okay.
indicating that the patient is during the inspiration and expiration, the tidalling can be noted in the water cell chamber, that is in the tube, that is normal only. Okay, that means the water level can be move upward while client is taking inspiration, and while client is doing expiration, the water level can go into down, that is the tidal. Okay, fluctuation of the water level indicating normal only, but if there is continuous bubbling indicating that what, there is a air leakage. Okay,
Clear.
so these are the important points related to the respiratory system. So, what are the earliest signs of hypoxia? Restlessness and confusion. That means if there is the client is having low saturation, how we can identify it? One thing, we can check the saturation level. If in a scenario, if it is mentioning that the client is having restlessness or confusion, you can check the vital signs, especially the saturation. Okay, and if the saturation is low, that indicating hypoxia. That means the confusion. Why? Because the brain cells is are starving with the oxygen, that indicate, that can be manifested with the confusion. And also restlessness also indicating, confusion and restlessness both indicating what, hypoxia. So we
Mm.
need to check the patient immediately. And what is the late sign? That is the earliest signs. Okay, what is the late sign? Cyanosis. Cyanosis means what? Bluish discoloration of the skin and mucous membrane. That is the late sign of the, which one? This hypoxia.
Apples.
Yeah. But next one, acute respiratory distress syndrome. How we can understood it? That means even if the client is getting oxygen, and even after the oxygen administration, if the saturation is not improving, that indicating that the client is going into a stage of respiratory distress syndrome. Okay, and we know in COPD what happened, there is a retention of the carbon dioxide in COPD, and also there is a barrel chest. Barrel chest means the pursely breathing. uh, the client will sit in a tripod position. Okay, why? Because the carbon dioxide is accumulated in the lung. It can lead to what? Respiratory acidosis. Okay, that means in COPD there is accumulation of the carbon dioxide in the lung.
Yes.
Accumulation of carbon dioxide in lung. Okay, are you getting my point? Okay.
Yes, yes.
Yeah, because in COPD, what, the client is not able to do the expiration completely. So what happened?
Mm.
The client is, the expiration is not completing. What happened? The carbon dioxide which is in the lungs will not expel out completely. It can lead to retention of the carbon dioxide in the lung. Okay, that is the significant problem for the COPD. Okay, that means here, so that only the patient will starving with the water. Here we can't administer too much oxygen. Only 1 to 2 liter per oxygen can be administered for the COPD patient. 1 to 2 liter per minute oxygen only we can administer for the COPD patients. Okay, and
Okay.
for the pulmonary embolism patients, okay, how we can identify a patient is developed pulmonary embolism? If the patient is having sudden dyspnea, chest pain, and this is very important. That means in a scenario,
Mm.
sometimes in a, that bow tie model type question, the complication, they will give any respiratory conditions like asthma, COPD, or any other condition, and sometimes they
Mm.
will, we can choose the complications. Okay, pulmonary embolism, and also in that fracture, also in fracture, and in any peripheral arterial disease, or any in such condition, that means in case of atherosclerosis or in case of emboli, the pulmonary embolism is a complication. So how we can identify the complicated stage? If the client is having sudden dyspnea and the stabbing chest pain with the tachycardia, all three symptoms are indicating pulmonary embolism. It is a life-threatening emergency. Okay. And in chest tube, it is also very important. Continuous bubbling in the water seal. Okay. Continuous bubbling in the water seal indicating air leakage, and not idling indicating, that is also very important. Not idling means there is no fluctuation of the water, okay, in the water seal chamber, indicating either the lung has re-expanded well, otherwise what happened, there may be some obstruction or kinking of the tube. So we need to check the tubings. And one tricky point is that immediately after the ICD insertion, if there is no tidalling, that indicating that there is obstruction. But after the ICD insertion, okay, that means in following 2 to 3 days, that means insertion has done, and after 2 to 3 days, if there is no tidalling, that indicating that re-expansion of the lung. So how we can confirm it? By doing the X-ray. By doing the X-ray, we can confirm it, and we can remove the which one, this the ICD. Understood? Because two things you have to get. If there is no tidalling, means two reasons are there. Either lung has re-expanded or there is an obstruction. Okay. So immediately after the ICD insertion, if there is no tidalling, it indicating that there is some obstruction. But if after 2 to 3 days of the ICD insertion, if there is no tidalling, that indicating the lung has re-expanded well. Okay, understood? So these are
Yeah.
the important points you have to keep in your mind in a respiratory system. Got it, Harkul?
Yes.
Okay.
Yes.
Yeah,
Yes.
yeah.
Yeah.
Next one, cardiology system. In what are the areas? If the respiratory is thorough, it's easy for the cardiology. In
Mm.
cardiology, mainly we have to focus for the that perfusion science. That means especially the vital signs, blood pressure. That's what heart rate, saturation. Okay. In addition, we can check in a patient is having any chest pain and the pain is radiating to the left hand, or there is jaw or back of the scapula, that indicating that what, MI. And if there is only chest pain which is relieved by rest or after the administration of the nitroglycerin, that indicating that what, angina only. But if the
Enjoying. Yeah.
pain is not relieving after, even after the administration of the nitroglycerin or even after the rest, that indicating that MI, myocardial infarction. Okay, we need to recognize the MI symptom and we need to manage it immediately. Okay.
Yeah.
And also for a heart failure patient, we need to check it whether the condition is worsening or improving. Okay. And shock, mainly we need to identify hypovolemic shock, cardiogenic shock, or septic shock. If there is a bleeding, which one is the reason? Hypovolemic shock, hemorrhage.
Hypovolemic.
Yeah. If there is any cardiac condition, which, for example, heart failure. Heart failure is contributing to shock, that is cardiogenic shock. Okay. And if the shock is related to any sepsis or infection, that is septic shock. But we need to identify which is the root cause for the shock. Okay. And also we can check the perfusion, the mean arterial blood pressure. Usually the basic tool means bradycardia or tachycardia. That means the heart rate. We need to check the rate of the heart rate and also the rhythm, whether there is any rhythm change like abnormal, the arrhythmia. Okay. And also important question asking medications are beta blocker, AC inhibitor, nitrites, and diuretics. Okay. So what are the points we have to keep in our mind? Main in MI or myocardial infarction, we can look for the pain. That means if the pain is radiating to the left arm and if the client is having diaphoresis, the patient is going into stage of myocardial infarction. Okay. So in heart failure, what are the signs we need to look for? In heart failure patient, we need to monitor the daily weight. That means we need to look for if there is any weight gain. And also we can check for crackles. If the client is having any pulmonary symptom, that is left side heart failure. Okay. That means if the client is showing any pulmonary symptom, pulmonary symptom means what? Left heart side failure. Left heart side. And if the client is showing systemic symptom means what? Systemic symptom like edema, jugular venous distension, that
Yes,
indicate,
right side.
yeah, right side heart failure. So you should very keen, okay, while analyzing one case scenario, okay. And also if the mean arterial pressure, okay, maybe is less than 65, that indicate poor perfusion. That means decreased cardiac output lead to poor perfusion, and it can lead to what? Kidney failure, liver failure, okay, that means. And but in case of right side heart failure, it can lead to what? Accumulation of the fluid. So it can lead to hepatomegaly, enlargement of the liver; splenomegaly, enlargement of the spleen; ascites, accumulation of the fluid in the peritoneal cavity, like that, okay. And in case of cardiogenic shock, what can be not? We can check the BP, okay. Hypertension will be there, and to compensate the cardiac output, the heart will contract more, so there may be tachycardia, and there may be inadequate perfusion, so cool and clammy skin will be there, and the perfusion or the blood supply to the kidney will get decreases, which can lead to decreased glomerular filtration rate. That means low urine output, okay.
They're not good.
Yeah, so these are the important point you have to look for if you are getting a question with the shock. Shock, mainly you focus for BP, tachycardia, okay, that means hypertension, tachycardia, cool and clammy skin, and low urine output. That means if you are getting a question that the client had undergone for any surgery, and after this post surgery or post operative period, the available urine output is decreasing. For example, minimum the adult client need 1 ml per kg urine output. How much? 1 ml per kg. That means if a client's weight is 60 kg, how much urine needed? 60 ml urine hourly is needed minimum, okay. That means 1 ml per kg,
1 ml per
yeah,
minute.
yeah, 1 ml per
Yes.
kg urine is needed for a adult, understood. And also in
Yes.
rare conditions at least 0.5 ml per kg is needed. For example, for a renal failure patient like that, minimum that 0.5 ml per kg urine is needed. Otherwise normal 1
Okay.
ml per kg, but minimum 0.5 ml per kg urine is needed, okay. So always check the
Okay.
weight with the urine output. And another important point, those who are getting beta blocker. Beta blocker example, do you know? Beta LOL, LOL drugs. That means
Yeah.
propanolol,
Mhm.
atenolol, like that drugs. Okay. So
Yes.
before giving beta blocker, beta, that means LOL drug. Okay. So before giving beta blocker, always check the heart rate. Check the heart rate. If the heart rate is less than 60, we should not administer beta blocker. Okay. And but those who are getting nitroglycerin, okay, those who are getting nitroglycerin, or nitroglycerin is a vasodilator. So vasodilator can cause what? Hypertension. So before administering nitroglycerin, we need to check the blood pressure. If the systolic blood pressure is less than 90, we should not administer nitroglycerin. For even in an MI patient, okay, we know if the client is having chest pain, we will check the what we mostly for we will recommend rest, and if it is not relieved by the rest, we will administer nitroglycerin, okay. But before administration of the nitroglycerin, always we should verify the blood pressure. If the blood pressure is low than the normal, we should not administer nitroglycerin. That point is very important for the question, okay. Nitroglycerin is not administered if the systolic BP is less than 90. Okay, and one more thing, if the client is already letting sildenafil or Viagra, we should not administer nitroglycerin, because sildenafil is also a vasodilator. So both will cause what? Vasodilator means it will dilate the blood vessel. Okay, so
Blood vessels.
vasodilator, yeah, vasodilator will dilate the blood vessel, which can cause what? Hypertension. So we should not administer if the client's BP is less than 90 mm of Hg, or if the client is getting sildenafil, we should not administer nitroglycerin. Okay, so hope you got a clarity on the cardiac. Cardiology system main focus for the cardiac output, decreased cardiac
Ye-
output, and the rate of the heart rate, the rhythm of the ECG strip. We need to find
Yes.
out the abnormal rhythm, and also the hyperkalemia ECG changes that I will tell you later. Okay, so but the core thing you need to understand what is the core one. Okay, the core thing only I am saying about perfusion. How we can check it? We can check the capillary refill. Okay, we can check the saturation level. We can check the warmthness of the skin. That means if it is cool and clammy skin, it indicating
Cool.
what? Inadequate perfusion. But if there is warm, indicating adequate perfusion. Okay, these are the things we have to keep it. Actually, this session will end up with this 40 minutes only. I will send another link. You can join for that. Okay. So next is neurological system. Neurologically, mainly we need to recognize the stroke symptom. How we can recognize the stroke symptom? FAST is the tool which we can use for a assessment of the stroke. F means facial
Okay.
drooping. A means arm
Yes.
weakness. S means speech difficulty.
Speech difficult.
T means time to call the emergency. 911. Okay,
Emergency.
this is the what early the
Yes.
recognition symptoms. We can, that means if the client fell down with unconsciousness, how we can rule out with the symptoms from hypoglycemia to the stroke. If because both can be happening unconsciousness, but while giving emergency management we should check the blood glucose level also. Sometimes the unconsciousness can be related to the hypoglycemia, so the client need the management for the hypoglycemia, not for the stroke. What, how we can correlate the symptoms from the hypoglycemia? We can use the fast one. Okay, that means F means facial drooping, A means arm weakness, S means difficulty to speech, T means time to call the emergency number, that is the 911. Okay, and also we can check the Glasgow Coma Scale. We can check the EVM. E means eye opening, B means verbal response. Okay, M means motor response. E6, V5, M5. That is the EVM score. See, EVM. Okay, that means E6, V5, M4. That is the normal. Total 15 is the normal. See, your total 15 is a good score, and if the client GCS is less than 8, or if it is means it is decreasing to 9 or less than 9, the client is condition is deteriorating, so that patient need immediate attention. 15 is a good score. Okay, and see, but if the GCS is improving, that is the patient's condition is improving. That means if you are in a scenario, if you are getting that the GCS score is improving from 12 to 14, that indicating that the client's condition is improving. Okay, but but if the GCS score is decreasing, what indicating? It indicating that the client's condition is deteriorating. Okay, that is the important thing. And next we can check for the increased ICP sign. Okay, increased ICP sign, usually the important one, here are there what, yeah, Cushing triad is the important signs for the increased ICP. Okay, that means hypertension, high, that means bradycardia and irregular respiration. These are the triad, means three symptom. Okay, three triad symptom. Increased BP, that means hypertension, bradycardia and irregular respiratory rate. Okay, that is the important signs for the increased ICP. And in late sign of this increased ICP is herniation of the blood organs. And if the client is having any unequal pupil, that means if you are checking the pupil and the pupil is not responding to the light normally, that indicating what there is a possible herniation and it's a life threatening complication. And the client is having worsening headache also, we can suspect for a hemorrhagic stroke, because hypertension is the main root cause for the hemorrhagic stroke, that means the rupture of the blood vessel. Okay, so when the BP is shooting up, the first symptom is the severe headache. Okay, that is the primary symptom for a hypertension. And if the client is having severe headache of the life, that indicating what, hypertension or hypertensive crisis, which can cause what, hemorrhagic stroke. And meningitis, usually we are recommending droplet precaution. And in meningitis, two symptoms we need to focus, that is the positive kerning sign and the positive Brudensky sign. Okay, positive kerning sign means while we extending the knee with a hip flex, the client will experience pain on the calf muscle. Okay, and in Brudensky sign means when we flex the neck, the client will automatically or involuntarily flex the hip or knee. That is the two positive signs for the meningitis. One thing, which one, Kernig sign, second one is the Brudensky sign. Okay, Kernig sign means when we extend the leg with the hip flexed, okay, the client will experience the pain. And the Brudensky sign means when we flex the neck, there is a automatic flexion of the hip and knee. That is the Brudensky sign. Okay, and next one, seizure care. Seizure care means always first we need to protect the airway. That means we need to turn the head to one side. Okay, that is to prevent the aspiration. Otherwise, it can cause aspiration. So protect the airway. And if the client is having a lot of secretions, we need to do suctioning for in a patient with seizure. We can provide sidling position. We should not apply any restraints to the client. And the important point, we should not apply any object into the mouth. It can cause what? Tongue bite or teeth breaking. So it can cause aspiration. The teeth can go into the airway and it can lead to obstruct the airway. Okay. And we can check the Glasgow Coma Scale trend, whether the condition is improving or the condition is deteriorating. Okay, these are the important for the neurological system. Okay, so and for the meningitis, the classic signs are the fever, neck stiffness or knuckle rigidity, and altered mental status. Altered mental status means confusion and drowsiness are the main symptoms for the which one, altered mental status. So in a case scenario with the meningitis, always we have to check for the fever. Okay, second, we can check for if the client is complaining about any neck stiffness or knuckle rigidity and altered mental status. For example, if the client is confused, that means the client is not oriented well. And if the client is drowsy, that indicating some neural hypoxia. Okay, that can be the reason for the meningitis. Meningitis means inflammation of the meninges. Okay, meninges is the covering. Okay, so these are the important point for the neurological system. And in endocrine system, mainly the decay and hyperosmotic hyperglycemic state. In decay means diabetic ketoacidosis. In diabetic ketoacidosis means there is an uncontrollable blood glucose level or hyperglycemia plus ketone bodies. It can lead to what? Accumulation of the ketone bodies can lead to metabolic acidosis along with the Kussmaul's respiration. These are the significant symptoms for the diabetic ketoacidosis. But in hyperosmolar hyperglycemic state, only there is high blood glucose level. There is no ketone bodies. Okay. But what happened, because of the accumulation of the blood glucose level in the blood will become concentrated, hyperosmotic. So it can lead to dehydration in case of HHS. Okay. And the client will experience neural changes, Mostly it occurs in type 2 diabetes mellitus. The main difference means DKA occurs in the type 1 diabetes mellitus and HHS is occurring in the type 2 diabetes mellitus. Okay, and when in a decay there is what happened, the potassium is accumulate. Okay, potassium can be accumulated. Initially it will be high, then when we administer, we know the in case of hyperglycemia, the primary management we can either we can administer which one, calcium gluconate, second D5 with the insulin, that is the management. So when we start the insulin, what happened, the insulin and potassium, because the insulin has a role to remove the potassium also from the blood to the cells. Insulin has a role to remove the glucose from the blood to cells. In likewise, insulin has a role to remove the potassium from the blood to cells. So what happens, it can lead to hypokalemia. That means when we administer insulin, the insulin will draw the potassium from the blood, and this potassium can give into the cells, which can lead to hypokalemia. Okay, so if a patient is getting any insulin infusion, always we should monitor for the hypokalemia. Okay, are you getting, Harkirtan? Am I
Yes,
confusing
yes.
or you are getting
No, no,
clarity?
no.
Yeah, okay.
I'm getting clarity.
That are the important points. Okay, that means the question can be very confusing, but if we have
Mm.
a thorough understanding about the theory, it can be what useful for. But insulin has the role to which one, on the glucose as well as for the potassium.
Potassium.
Yeah, glucose and the potassium. Understood? So that means when
Yes.
the patient who is getting insulin infusion, two things we need to monitor. What are the two things? Glucose and
And
potassium, because there is a risk
potassium.
for hypoglycemia
Hypokalemia.
as well as hypokalemia, because insulin will draw the blood glucose and the potassium to the cells. Okay.
Yes.
Next one, myxedema coma. Okay, myxedema means it is a life-threatening hypothyroidism. Hypothyroidism means decreased production of the thyroid hormone. Okay, so if the
Mm.
hypothyroidism is severe and life-threatening, that condition is called what? Myxedema coma. But if there is a hyperthyroidism, what is that? Is thyroid storm. That's see the difference. Okay, if it
Mm.
is a hyperthyroidism, storm means what? It's a severe. Okay, that means
Okay.
hyperthyroidism leads to thyroid storm. Hypothyroidism leads to what? Myxedema coma. So we know the thyroid hormone have a direct impact on our metabolism. Okay, so what happened? The metabolism will get higher. It can lead to fever, increase in the body temperature, tachycardia. Okay, then hypertension, agitation, and the hypothyroidism complication is the thyroid. Sorry, yeah, hyperthyroidism. The complication is the thyroid storm. So this thyroid storm is a life-threatening emergency. Okay, what are the main symptoms we can look for a patient with thyroid storm? Fever, tachycardia, hypertension, and agitation. Okay, but in case of complication of the hypothyroidism, what is the complication? Myxedema coma. So everything will be reversed. That means instead
Mm.
of fever, here is low temperature. That is hypothermia. Okay. Instead
Mm.
of tachycardia, there is bradycardia. Instead of hypertension, there is see one.
Hypertension.
Yeah, that means you can memorize it with the high means hyperthyroidism lead to all the
Mm.
parameters into high, and hypo
Mm.
means low. So low thyroid hormone leads to all the parameters into lower level. Okay,
Low.
yeah. So there is in thyroid storm there is fever, tachycardia, hypertension, agitation, and emergency. And in case of myxedema coma or severe hypothyroidism, what happened? There is hypothermia, bradycardia, hypertension, and a decreased level of
Mm.
consciousness. See the difference here is agitation, but here is
Mm.
decreased level of the
Decrease.
consciousness. Okay, and other important point, before if a physician has ordered to administer insulin to a patient, Before starting insulin, always monitor the potassium level, glucose as well as potassium level. Why?
potassium
Yeah, why? Because
because they
insulin
decrease
has a role to remove the potassium and the glucose from the blood
glucose
into the
blood
cells. So always we should monitor for the hypoglycemia and hypokalemia. So we need to
anemia.
frequently monitor the glucose and the potassium. Okay, that means the important point, never start insulin drip without frequent glucose and potassium monitoring. Okay, understood? Any doubt on all
Yes,
these points? These are highlighted
that
points, the question asking area points only. Okay.
uh,
Hope all these systems are thorough for you. Okay, so
yeah.
you can
Okay.
do questions maximum, so you will get a clarity. So in renal
Okay.
system, yeah, renal system, what is the main role? That is to for the urine output. Okay, so urine output means we can, the important thing, we know the urine output is related on our glomerular filtration rate. That means the blood supply kidney, if it is decreasing, what happen? If it is decreasing, it can lead to decreased glomerular filtration rate. Glomerular filtration rate, it can lead to what? Decreased urine output. Understood? Decreased urine output. Okay, so we know all the nitrogenous waste products are eliminated through the urine only, like blood urea nitrogen, urea. Okay, blood urea nitrogen, creatinine, potassium, all these things are eliminated through the urine only. So you think, when there is a decreased urine output, what happens for this waste product? Is it eliminating it through the urine? No. This waste product, like this one, what are the potassium, okay, creatinine, blood urea nitrogen will not eliminate it through the urine, so it can lead to what? Accumulation. Okay, accumulation of the creatinine, accumulation of the blood urea nitrogen, and accumulation of the potassium. Okay, so for a AKI means acute kidney injury. CKD means chronic kidney disease. Okay, in such patients we need to manage for the hyperkalemia also. Okay, and also dialysis indications and that means the excess creatinine and this excess hyperkalemia can be removed through the dialysis only, because these waste products are accumulated in the blood. It need to, there is no urine output, so we need to remove these toxic substances from the blood through the dialysis, either peritoneal dialysis or hemodialysis. Okay, but during the dialysis, that I will tell you. And also next one is fluid overload and dehydration. That means in case of polyuria, okay, if there is excess urine output or polyuria, what happen? Dehydration. Okay, and if there is oliguria or decreased urine output, what happen? Fluid retention. Okay,
Overall,
yeah, that means here in polyuria means excess urine output, that means excess water is losing through the urine. But in oliguria, what happened? There is decreased urine output, so the fluid is not eliminating as the urine, so it can lead to fluid retention. For example, it can lead to edema. Okay, hypertension can be occur. So here we need to monitor for the patient fluid overload as well as dehydration. Okay, so this main significant for to identify a renal perfusion is the specific marker is the blood urea nitrogen and the creatinine. Okay, creatinine is
mhm,
the most specific marker for to identify the function of the renal system. Okay, and how we can identify if the patient is having acute kidney injury? We can check what if there is a sudden oliguria. For example, I have said previously, the client had undergone for any surgery, so during the post-operative period, while monitoring the urine output, and we have noticed that there is a decreased urine output. What it indicating? It indicating acute kidney injury. That means the hallmark signs for the acute kidney injury is the sudden oliguria plus rising creatinine. Okay, That means oliguria means what? Decreased urine output. So decreased urine output means the urine is not producing adequately and it is not eliminating through the body. So this waste product can be accumulated in the blood because the blood is only filtering into urine. So if there is decreased urine output, this toxic substance can be accumulated in the blood. Understood? So,
Yes.
yeah, that means the creatinine in blood urea nitrogen level can be increased, and also potassium level can be increased in case of kidney failure or renal failure. Okay, and when we know that the hyperkalemia is a life-threatening complication, that means if it is not managed immediately, what happen? It can cause life-threatening complication. Arrhythmia can cause, and it can cause death of the patient. So how we can identify hyperkalemia in the patient? We can we can check the ECG. Okay, if it is a tall T wave or peaked T wave, and if the client is having muscle weakness, and if the potassium norm, do you know what is the normal potassium level? 3.5 to 5 milliequivalent is the normal potassium level. Okay, per liter. Okay, and if it is greater than 5 is the board normal, but 5 point up to 5.5 it is borderline, but if it is greater than 5.5, that indicating hyperkalemia. Okay, so the hyperkalemia can be managed immediately, otherwise it can cause arrhythmia, life threatening complication. Arrhythmia can occur. So how we can identify the client condition is worsening? We can monitor the ECG. Okay, that means if there is a tall T wave, that indicating hyperkalemia. Okay, and also we can monitor the blood potassium level. 3.5 to 5 is the normal one. If it is greater than 5.5, the client need immediate attention. Okay, that means up to 6 it can be manageable. If it is greater than 6, there is a risk for arrhythmia. So immediate management is needed. What is the immediate management for the hyperkalemia? Calcium gluconate is the first line management. Okay, calcium gluconate.
Calcium
Yeah,
gluconate.
second, insulin
In
administration.
the
We know,
insulin
yeah,
dextro with the
dextrose, yeah,
dextrose
dextrose
5%.
5%. We can add the insulin. Third one is that one, okay,
The
X-lite solutions.
enzyme.
Yeah, that's it.
Yeah.
And also those who are taking AC inhibitor, that means ACE prill family is coming under the AC angiotensin
AC.
converting enzyme inhibitor. NSAID means non-steroidal anti-inflammatory drug. Okay, that means if the client is having severe renal failure, ACE inhibitor or non-steroidal anti-inflammatory drugs cannot work, and also potassium supplement is not recommended. Why? Because already if the client is having severe renal failure, there is a decreased urine output. That means the potassium is accumulated in the blood. So if you are again giving potassium supplements, what happen? It can lead to worsening of the hyperkalemia. Okay, so we should not administer potassium supplements to a patient with chronic kidney disease or severe renal failure. Next one, AC inhibitor. What happened this AC inhibitor? AC inhibitor is a vasodilator. Okay, this vasodilator can decrease the glomerular filtration rate. Okay, so that means the blood supply to the kidney will get compromised. It can lead to decreased glomerular filtration rate. It can lead to decreased urine output. So the AC inhibitor is not, already the renal failure patient have the decreased urine output. Okay, so if we are if we are administering AC inhibitor, it can further worsen the oliguric symptoms. So we should not administer AC inhibitor for a patient with uh, severe renal failure. Okay. In addition, the non-steroidal anti-inflammatory drug is also not recommending for a patient with severe renal failure. Why? Because this non-steroidal anti-inflammatory drug can cause vasoconstriction in the afferent arteriole. Okay. Actually, the afferent arteriole and efferent arteriole means, efferent means, I will tell you. See, afferent means towards. Okay. Towards kidney, Next, efferent means away from the kidney. That means the from the kidney. Okay, efferent means from kidney. From kidney. See, here, uh, why we are not administering AC inhibitor for a severe renal failure means the arteriole which are emerging from the kidney will get vasodilated. That means the amount of blood, okay, which will not pump out through the vasodilated artery properly, it can lead to glomerular filtration. It will affect the glomerular filtration rate. But in afferent arterial means the arteries which are going into the kidney, okay, that cause vasoconstriction. Vasoconstriction means what? There is a narrowing of the blood vessel. So if there is a see, I will draw one picture. See, this is the kidney, okay, this is the towards water coming, that is the afferent arteriole. Understood? Okay, and the
Yes.
whatever the arteries emerging from the kidney, that is efferent arteriole. Okay, you can
Oh,
just imagine that.
yes.
So if this blood vessel is getting narrowed, what happened? The blood which is reaching into the kidney is decreasing low, which will leads
Um,
to decreased glomerular filtration rate. Okay,
yes.
and here also, if the efferent arteriole is getting vasodilated, what happened? There is too much supply of the blood through the efferent arteriole. That means it can also decrease the glomerular filtration. That means the blood is rapidly removing through the kidney through the efferent arteriole. So here also the filtration, the volume of the blood which are undergoing for the filtration will get decreased in case of vasodilation in the efferent arteriole. Okay, understood the difference? In
Yes.
case of yeah, in case of non-steroidal anti-inflammatory drug, the afferent arteriole will get vasoconstriction. It can lead to decreased glomerular filtration rate. But while administering AC inhibitor, what happened? The efferent arteriole will get vasodilated. It can lead to decreased glomerular filtration. The both will cause
Mm,
decreased urine output. Understood the difference?
yes. Yeah.
Okay, yeah. In
Mm,
hyperkalemia, we should not administer. Why? Already there is excess potassium in the blood. Again, if we are administering potassium supplements, it can cause worsening of the potassium.
hyper.
Yeah, potassium
Yes.
level can be uh, will become too much, and it can cause life-threatening complication, arrhythmia. So we are not administering potassium to the patient with the severe renal failure. This is the basic. It is very thorough. This theory you can, because the question can be can be applied in the question analysis. So you should thorough with it. Okay. And also, if there is a fluid overload, how we can identify it? If the client is having systemic symptoms like edema, crackles, jugular venous distension, weight gain. Okay, so for a patient with the kidney failure, for a patient with the heart failure, always we should check the weight gain, weight of the patient. That means if there is a weight gain, that indicating fluid overload. Okay, and if there is fluid overload suspected, always we should restrict the fluid. For a renal failure patient, we can't administer too much volume of fluid. And also heart failure patient, because in the heart failure the heart is not able to pump out adequate blood. That means if we are infusing too much volume of the fluid into the client, it can lead to fluid overload. Same like kidney, the kidney is not working normally. So if we are infusing too much volume of the fluid into the patient, that fluid can cause hypervolemia, and this volume of the blood is not filtered into the urine because the machine is already damaged. So this blood is not converting into the urine, so it can lead to what? Fluid overload. Okay, so
Yes.
to manage with the edema and fluid overload, the treatment of choice is diuretic. Okay, we know the diuretic types. What are the types of the potassium sparing diuretics? We should monitor for the hyperkalemia. Okay, that means the spironolactone. Okay, potassium sparing diuretic like aldactone or spironolactone. Okay, spironolactone we should monitor for which one? Hyperkalemia. Okay, If it is a loop diuretic, what we should monitor? If it is a loop diuretic, we can example Lasix or furosemide.
Yes.
Yeah. If it's Lasix or furosemide, we can monitor for the hypokalemia. Understood? Hypo.
Yes.
This is also very
Definitely.
important. Okay. This potassium spironolactone we can monitor for the hyperkalemia. Why? Because
Hyperclean.
here urine output is increasing, but the potassium is sparing. It can lead to accumulation of the potassium in the blood. But in loop diuretic, what happened? The potassium is losing through the urine. Okay, so it can lead to hypokalemia. Both are lethal conditions. It can cause arrhythmia. That means both the hyper and hypokalemia cause arrhythmia. So it should not get monitored carefully. Okay, and the high alert medications are insulin, anticoagulant, opioid, and digoxin. Insulin, what we need to know, already we know insulin has two roles. So we need to check the potassium level and the blood glucose level. Okay. And what is the complication of anticoagulant? Anticoagulant will cause bleeding. That means
Bleeding.
heparin and warfarin.
Warfarin.
Yeah, warfarin. And also those who are getting heparin, okay, if it is a heparin, we need to monitor the APTT value. Okay, and if it is a warfarin, which one we can monitor? We can monitor the INR. This is very important. And for the digoxin means we should check the heart rate, apical heart rate. Okay, if the heart rate is less than 60, we should not administer digoxin. We should hold the digoxin. Otherwise, it can lead to what? Okay, because the main function of the digoxin is to decrease the myocardial contractility. So, if the heart rate is less than, I will write in the capital letter. Okay, if the heart rate is, that means before the administration of the digoxin, always we should check the heart rate. If the heart rate is less than 60, we should not administer digoxin. We need to hold it. One more thing, if a client has the hypokalemia, okay, hypokalemia can lead to digoxin toxicity. Okay, hypokalemia lead to digoxin toxicity. So if in a scenario, if there is low potassium level, okay, one thing, if the heart rate is less than 60, we should not administer digoxin. Second, if the potassium is lower than 3.5, we should not administer digoxin. Why? Because this digoxin can cause digoxin toxicity. Okay, that this point you have to keep in your mind. And for a opioid patient, if we are administering opioid, what we need to monitor? It will suppress all the body functions. Okay, the client will become drowsy. Okay, drowsy. Then respiratory depression. These are the main complications we can monitor for those who are taking opioid drugs. Okay, and what is the antidote for the opioid? Antidote, you know? Antidote is naloxone. Okay. Okay, Harkit, understood? The antidote,
Yes. Yes.
for the opioid
Naloxone.
is naloxone. These are the points you have to keep in your
Naloxone.
mind.
Yes.
Mainly, we can check for any toxicity signs, and we can check the insulin action time, and if there are any interactions and the drug in the contraindication. For example, see if the client is getting aspirin, okay, aspirin, NSAID, we should not administer, avoid in peptic ulcer. You know why? Avoid in peptic ulcer, because it can cause bleeding. Okay, these are can cause bleeding. So NSAID and aspirin is not recommending for a patient with the peptic ulcer, okay, or gastric ulcer, because it can cause bleeding. In case of esophageal varices, in such cases also aspirin and NSAID is not recommending. Why? Because it can cause bleeding. Okay, What are the symptoms which coming under the digoxin toxicity? Digoxin toxicity, the significant symptoms are nausea, vomiting, okay, anorexia, the visual halo. That means the client can see some halos around the object, okay, halos, and if the heart rate is less than 60, we should not administer digoxin, okay. And the warfarin, usually the INR goal is 2 to 3. What is the antidote for warfarin? Vitamin K. So, what is the antidote for the heparin? Protamine sulfate is the antidote for the heparin. Okay, those who are getting heparin, we should monitor the APTT value. And also rapid acting insulin like Aspart or Lispro, the onset of action is 15 minutes and peak action is 1 hour. That means during this period we should closely monitor for the hypoglycemia. That means the action is peak within 1 hour, so the food is ready before administration of the insulin. The client's meal should be get ready, otherwise what happen, after the administration of the insulin, if the client had not taken food, it can cause what, hypoglycemia, okay. And also those who are getting opioid, we can monitor for the respiratory depression. And if the respiratory rate is less than 12, or if the client is sedated, we can't administer opioid, okay. And the AC inhibitors are not recommending in case of pregnancy because there is a danger to the fetus, okay. So AC inhibitors are not recommending for a pregnant mother. So these are the system mainly focusing for the question, not completed, but there are some musculoskeletal and some important points. I want to discuss that point also. And I think infection, you are thorough with it, okay. Airborne infection mainly tuberculosis, measles, varicella, okay. For the airborne infection precaution, what are the things we need to give? N95 mask and negative pressure room, okay. And the door always should get kept closed, okay. And for even the patient is on the airborne precaution, while ambulating the patient, which mask we can provide? Surgical mask can be provided, okay. While transporting the patient, which mask? Surgical mask, okay. Surgical mask for the client. These are the important ones. And droplet precautions mainly in meningitis and influenza. Here we can provide surgical mask only. Contact precautions, I have already said, closed difficile and MRSA. Important, we need to use gown and gloves, okay. And closed difficile, we should wash even after the removal of the gloves, we can wash our hands with the soap and water, and sanitizer is not enough because it won't kill the pores of the bacteria. And if there is a sepsis is suspected, fever, tachycardia, hypertension can be, we should monitor it. And also we can monitor the lactate level, okay, because it can lead to lactic acidosis. And here the management is IV fluid administration, that is to prevent the shock, and also to prevent the infection we can administer antibiotic, okay. And this one is also very important, neutropenic precautions. What are the neutropenic precautions? No fresh flower or fruits, the client should wear the mask, and proper hand washing should be maintained, okay. And we should limit the visitors. These are the important points for a patient. For example, those who are getting chemotherapy, or those who are HIV patients, and also those who are organ transplanted patients, okay, organ transplanted patient. In such patient need neutropenic precautions. That means this patient, neutropenic means the WBC count will get low, neutrophil get low. These are the one which are providing our immunity. So if these levels are low, what happen? The client can easily get infection. So we can minimize the infection rate by doing some precautions, avoiding the fresh flowers, avoiding the fresh fruits and vegetables, by giving mask and by doing proper hand washing. And also we can avoid the visitors, sick, especially the sick visitors, avoid overcrowding. Like that we have to take the precaution measures, okay. And we know delegation, do you have any doubt? I think that's thorough for you. Harkirtan?
Yes, yes.
Yeah,
Yeah.
you are thorough, no? You can go through it.
Yeah, I go.
Yeah. All these things you can go. This is very important, but simple one only in documentary. We know we need to identify the bacteria.
Yeah,
We can assess the
streptococcus and
skin,
stuff.
yeah,
Yeah.
redness, warmth, swelling, tenderness, fever, and also the color of the discharges. Okay, that means whether it is a purulent discharge or a serosanguinous. Serosanguinous is normal. Purulent means it indicating infection. Okay.
Infection. Yeah.
Yeah, so in such case, if the infection is suspected, the priority action is to administer
Is
antibiotic,
anti.
that is to prevent the sepsis. Okay, and also we can promote the safety by marking the border of the wound, elevating the limb, and we should not apply heat over the infected wound. Why? Because the heat can spread the inflammations. Also, we should not apply heat over the inflammatory infected wound. Okay, and how we can reduce the infection by doing the hand hygiene and also by avoiding any breakage in the skin. Okay, because through this breakage the bacteria can migrate and can cause infection, so always wear gloves while giving wound care. Okay, same like only all the and infection the client need
So,
antibiotics. Okay, so yeah, and also no sharing of towels and linens. Help
mm,
us sister. Yeah, this you can go through it. Okay, if you have any doubt, you can ask to me. And this one is very important. See, for the wound care. Wound care means the wound we always maintain in a moist environment. That means it should not dry. Why? Because the moist wound can fasten the cell growth and for the healing. So the wound should not get dried. Always the wound should get moist only. Okay. Dry wound, what happened? Dry wound can kill the cells. It can lead to delayed healing. So always the
mhm,
wound should kept moist rather than dry. Okay, and also we can change the position every 2 hourly. That is to prevent the pressure injury. All the pressure points should be padded. Padded means that is to prevent the friction between the skin and the linen. We can pad the pressure points like the ankle, the knee. Okay, these are the then even the shoulder joints are prone to get pressure injury, so it should be padded. That is to prevent the friction. Friction can cause bed sore, so to prevent the friction, we can use the padded dressing. Okay, and also medication safety. Those who are getting the silver sulfadiazine, for example, burns patient, we are applying the silver sulfadiazine. But we should monitor the WBC level. Why? Because the silver sulfadiazine can cause what it can affect the bone marrow, can lead to bone marrow suppression. So we know the WB is producing from the bone marrow. If there is a bone marrow suppression, the level of the WBC will be low. That is lead to leukopenia. So if there is the leukopenia is not that means WBC level less than 3000, we should stop the use of silver sulfadiazine. Okay, and also the topical steroids are not recommended for a long term use. Why? Because this can cause skin thinning. Okay, thinning of the skin, so easily bruising, it can lead to easily what skin breakage can cause. So we the prolonged use of the steroids are not recommended. Okay, and also those are taking antibiotic, the full course of the antibiotic need to get completed, otherwise the client won't get the required result. That means the bacterial growth cannot be prevented, or the bacteria can't kill completely, so the antibiotic course should get completed. And also we can monitor for the allergy. Okay, and I have always said, if there is an infected area, if there is an, for example, appendicitis, that means there is an inflammation of the appendix. In such area, we should not apply the heat, because the heat can cause rupture of the appendix. Okay, so the heat is not applied over an appendicitis area. Wherever there is an infection or inflammation suspected, we should not apply heat over the infected area. Okay, those are the main thing. So actually this theory is mainly focusing for the NCSBN criteria. Okay, under the criteria only I have selected the topic. You just go through it, you will get a clarity on it. Okay. And this PPU, no, the order, yeah,
Gra-
this also. Mm, in between, one more, this one is important. Lyme disease. Okay, Lyme disease mainly the rash is bullseye. It is a tick-borne disease. The treatment of choice is doxycycline. Okay, and
Yeah.
Zika virus also, it is a mosquito-borne disease. Okay, this pregnancy precautions need to get, that is not that much, and the rash is maculopapular rash. The Lyme disease is important.
I do the question in Lyme disease as well
Yeah,
yesterday.
Lyme disease is important one.
And
You
I
just
did the
do the,
question.
yeah, questions. I will do here and there. Yeah. Actually, in another slide, I have added some detailed explanation of the Lyme disease. Okay, either you can,
Okay.
otherwise I will tell now. One second. Lyme disease is important. Yeah, the erythema. Okay, that means the rash of the Lyme disease known as the bullseye rash. That means a red ring with a clear center. That
Mm.
is the speciality for this bullseye. Here also, the client will experience the symptoms like fever, chills, fatigue, joint pain, muscle pain. Okay, especially the knee pain. Okay, main treatment is antibiotic. In early stage, we can administer doxycycline, but in severe stage, we can administer ceftriaxone IV. Okay, that is the difference for this Lyme disease. You just
Okay.
keep in your mind, yeah. Okay, in early Lyme disease, stage of Lyme disease, we can administer doxycycline. In severe
Mm.
cases, IV ceftriaxone. Okay, so the prevention is also very important question asking area. I got a question from this.
Okay.
That means we can wear long sleeves while we walking through the wooden area. That means in a forest, through we are walking through a forest or
Mm-hmm.
wooded area, we can wear the long sleeves. And also we can use the insect repellents. That means the it will protect our skin from getting bite from the mosquito. Okay, so mosquito repellent or insect repellent can be used. We can check our body for any ticks. Okay, that means after, when we exposing to the outer area, we can check our skin for any tick is stuck in our skin, and if it is there, we can remove it. Okay, remove the what that ticks immediately when we notice it. Otherwise, it can cause what deeper infection into the skin. That this Lyme disease is very important. Okay, important is management preventive measure only. What are they?
Mm.
Wear long sleeves in while walking through in a wooded area, and also we can use the insect repellent and to check the body for ticks and when we exposed to a outdoor. Okay, and remove the ticks promptly with the twister. Okay, main the rash is bullseye rash, eye rash. What is the specificity here? A red ring with the clear center. That is the main specificity for this. So see, I have added some questions also. If you get time, please go through the questions. Okay, this is, I
Okay.
have
Yes.
covered most of the theory within this question. This question is just to cover your theory. Okay, just go through, read it. If you have any doubt, you can ask to me. Actually, you know the
Okay.
strategy for the each question analysis. I have already taught everything. So while doing each question, you have to check which strategy I need to apply. Okay, that means if this is a priority based question, we can apply the ABC priority. Okay.
Yes.
Or
Yes.
Maslow's hierarchy. ABC is intact, we can check for the pain, we can check the safety of the client, and we can go with the what nutrition, health education, documentation, like that is the priority. Okay. And if it is a critical situation, assessment will come later. That means in case of emergency, implementation come first. Okay, but in a routine, what is the first one? If it is a routine scenario, assessment come first. But in an emergency, which one? In an emergency, we should stabilize the client first. So implementation will come first. Understood the difference? Okay.
Yes, yes.
Yeah. Then other thing. Then tomorrow I will take about the important of the maternity mental health nursing. Okay. So I think and arrhythmia also. That is the difficult one. So that only I kept last. Actually, but you should thorough with other whatever the topics which I have discussed in today's session. You just do
Mhm.
concentrate and you just minimize the wrong options. Okay, try to minimize the wrong
Okay.
answers. And also ethical and legal aspect already I have taken many times. You are thorough with that. Delegation, ethical and
Yeah.
legal aspect,
Yes,
safety,
yes.
yeah, HIPAA, then
Yes.
violence, in the partner violence, child abuse. Uh, so all these areas you do practice, and also consent. Okay, consent, advanced directives, then fire precaution, then mm, seating of the child. Okay, car seating. The child should seated in the back only, not in front. Okay,
Yes,
so
yeah.
yeah. Then in the part the if there is any suspected child abuse, always report. Immediate reporting is mandatory. Okay, that is very important one. Next topic, musculoskeletal, the cane usage, the crutch walking. That I will take tomorrow. Okay, crutch walking, spica cast,
Yeah.
and that. See here in while doing that in the renal system, one more thing. Those who are getting dialysis, we can monitor for the disequilibrium syndrome because they're rapidly removing the waste product. So it can cause what altered mental status. That is the disequilibrium
Okay.
syndrome can be noted, and also for a
What's
musculoskeletal
which term? Can you repeat the term? With
disequilibrium syndrome. I will see renal system. No, see this one. I will mark it. Those who are getting dialysis.
yes, yes.
Okay, what are the things we can watch for? The hypertension, we can watch for the cramping, and we can watch for the
And this.
disequilibrium syndrome. Why?
Yeah.
Because the urea is rapidly removing from the blood. So what happens? The fluid can shift into the brain. It can lead to what? Cerebral edema. Okay, so it will affect the brain. It can cause what? Disequilibrium. Balance will
Confusion.
lose. That is the
Disequilibrium.
disequilibrium
Okay.
syndrome. Rapid removal of the urea can cause shifting of the fluid into the brain cells. It can cause cerebral edema. Okay, so that is the main thing. I think today's topic you are clear with that. If you're having any further doubt, you can ask to me. No problem. Okay.
Yeah.
So
Yes.
yeah. Um, so and do
So,
maximum
okay.
yeah questions and tomorrow you don't get panic. Tomorrow you just take rest.
Okay.
Yeah, whatever
Okay.
whatever the theory we are discussing, it you just recollect it. Actually, today's class was not. I just tried to recollect all the points. Not went too deeply. Just the question asking areas. I just recollected for you. It will helpful for you.
Mhm.
I believe so. Okay, so don't worry.
Yes, yes. Mhm.
So, how was today's class? Was it benefit?
Was it? Yes, yes, it's effective
Yeah. Okay.
because I did some question and I was confused that one, but now I cleared that one. What was the reason?
Yeah.
And
Yeah.
yeah, I cleared that
So
one. Yeah.
mainly the focusing for the strategy, that is the important. Actually, not only strategy, we have to shift our mind. You have to believe yourself that you are going to crack.
Mm.
Like that, you just believe. You just tell your mind. You just write down in your book that you conquered the exam like that. Visualize it. Okay, that will make you. That means if you are giving positive input, you will get the positive output. Okay, so like that, if you do practicing, first of all, you just pray well. Okay, give everything to God that you have prepared a lot. The rest is God's. Okay, so
Yeah.
you you do well because the success or fail that not in your hand. We can do practice, we can prepare well, but the end is on the God's hand only. That is not in our hand. We can't predict anything. Anything can happen. Okay, but we should be very faithful to God that everything is going means go. I believe so. That's only I'm saying.
Mm.
Nothing is
But it's
impossible.
true, it's true.
Yeah,
Yeah.
yeah. Nothing
We
is
just
impossible through.
do
Yeah,
work hard and
yeah. So
God will give the answer. Also true.
yeah, even now I am going into two difficult situations. I know that, but for everything, God has a plan. So God will
Mm.
not leave us as like because God has a great plan on us. Okay, so
Yeah.
don't get tensed. Everything will get fine. Okay, so best wishes. Okay, if you have any
Mm.
doubt or anything, you can ask to me. Okay, so thank you, Harkis. Could do well. Okay.
Okay.
Okay, best
Thank you
wishes.
so much.